Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. Today's presentation, Need Health Insurance? New Savings Are Here through the Health Connector. We have a number of participants who have signed up for today's presentation, but we are going to go ahead and get started at 2 p.m. today as scheduled. My name is Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleague, Nikki Conti, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality on your screen. We will be monitoring your questions through this channel. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you've written. If you have a specific personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find local help from a navigator. We are recording today's call. Following today's meeting, you'll receive an email with the presentation, along with a brief survey about the information we've shared, so there's no need to take detailed notes. Please complete the survey if possible, as we'd appreciate your feedback on today's session, and your input will help us develop future presentations. So without further ado, I'd like to introduce Nikki Conti, and we'll get started on our presentation today. Thank you, Nikki.
Thanks so much, Shaitra, and thank you everyone for joining today's presentation. So I will dive right in, knowing that there are many of you who've signed up today, so we may be expecting a few others to join as we go. So what I'm planning to cover, first I'll start off with an overview of the Massachusetts Health Connector, just so you all know who we are, and then I'll also touch upon the American Rescue Plan and how that now impacts some additional savings that you can get through us. I will spend time talking about getting coverage through the Health Connector, then talking about how you can get help with this process. There are lots of details that I'm going to be going through, and as Shaitra said, no need to take detailed notes. You will get a copy of this presentation, but I'll also plan to do a quick summary. So I'll go through key takeaways, so that as you're stepping away from this session, hopefully you can, kind of feel like you can pull it all back together. At the end of the presentation, we've got links to a number of different resources and also some sample flyers. So I'll step through those slides as well with you. So going into an overview, I just want to talk a little bit about what the Massachusetts Health Connector is. We are the state's health insurance marketplace, and we're here to offer individuals, families, and small employers access to affordable health insurance coverage. So you might be wondering, thinking to yourself, okay, who is it that gets health insurance through the Massachusetts Health Connector? Maybe you've heard of us before, maybe you haven't, but it's essentially people who don't get health insurance through their job or through another source. A lot of people who apply qualify for help paying for coverage, and people can also buy dental insurance through the state's Health Connector. So let's level set a little bit about the Health Connector plans. What I want to do on the slide is essentially just give you some peace of mind that all of the health plans sold through the Health Connector meet both state and federal standards for coverage. So the plans are all comprehensive. When you're in Massachusetts, if you're thinking about being penalized when you file your taxes, know that if you take a plan, if you enroll in a plan through the state's Health Connector, you would not be penalized. All of our plans do meet the state standards. So starting from the left, I'm going to just orient you a little bit to the types of coverage that are available through the Health Connector. First off, I want to say that all of our plans are qualified health and qualified dental plans. So again, they meet the standards, and depending on where you live in Massachusetts, you're going to see a variety of plans from leading insurance companies. So you will see plans that are available in your area. And the number of plans that are going to be available are, of course, going to depend based on that particular zip code. Excuse me. In the middle column here, you're seeing health plans with advanced premium tax credits. I'm going to spend a bit of time talking about advanced premium tax credits during today's presentation, particularly because of the American Rescue Plan savings. What I want you to know up front is that people with incomes in a certain range are going to be able to qualify for tax credits to reduce those monthly premiums. And again, I'll provide more detail when we get a little bit further. Now, specific to Massachusetts, we offer connector care plans. So people who are in lower income ranges and meet other eligibility requirements may qualify for these low or no cost comprehensive insurance plans. And again, I'll spend more time there. I'll say a few words about catastrophic plans. These are available to individuals under the age of 30 or if someone meets a hardship exemption. We of course offer them, but I just want to acknowledge that typically these are lower cost premium plans that have higher cost sharing, so higher deductibles, higher co-payments at point of service. So they are here in case anybody is looking for that type of coverage, but you want to keep some other things in mind if you choose to enroll in a catastrophic plan. And then lastly, dental plans. Know that they're available for individuals, children, families, small employers, and these include pediatric only plans or plans with lower or high deductibles. So let's spend a moment talking about the American Rescue Plan. I won't go too deep into this, but rather just acknowledge that it was signed into federal law in March of this year. And essentially, through the American Rescue Plan, it makes financial help related to health insurance available to many more people across the country and in Massachusetts. So a lot of people who already get help paying for insurance through the Health Connector right now may see even more savings. And a lot of people who did not qualify for help before will now see lower monthly premiums. And I'll talk in more detail about that, but let's think of that. Let's keep that in the background, or a little bit of, keep that as a backdrop. There are more and new opportunities now because of the American Rescue Plan. So let's take a look at what kind of savings people could see. Now, what I'd like to say here is that the types of savings someone could get access to are going to vary based on where they live and their age. So for example, if we are talking to a 50-year-old living in Worcester, Massachusetts, and their income is around $44,660, that person would be eligible for a health insurance plan with APTCs, or advanced premium tax credits. And prior to the American Rescue Plan, their monthly premium would have been $371.58. Now, with the American Rescue Plan, that person's premium drops down to $269.82. And so they're seeing a monthly savings of over $100, which we think is fantastic. Now, shifting gears a little bit, if you're looking at the Boston area to a younger person, 30 years old, making about $30,000, if that person was otherwise eligible, they could enroll in a connector care plan type 3A. And their monthly premium before the American Rescue Plan savings was $89. and now their plan cost would be $75.91. So just a little bit over $13 worth of savings, but still a significant savings, still a good savings. So going on to, I won't go through Great Barrington. I'll let folks take a look at that. You see how we've structured this. But I want to acknowledge if anyone is on today's webinar from the islands, typically the cost of plans available on the islands are more expensive here in Massachusetts. So here we're looking at a sample 45-year-old living in Nantucket, making just over $51,000. And based on that person's eligibility, they would have qualified for an unsubsidized health insurance plan. So that would have cost them about $650. And now with the American Rescue Plan, their new monthly premium could be as low as $366 a month, seeing more than $284 worth of savings. So that really is something significant to take into consideration. So let's go into an overview of our organization and very specifically who can apply. So when you are thinking about applying for coverage through the state's Health Connector, there are a couple of requirements that you need to keep in the back of your mind. One, you need to live in Massachusetts. You need to be a U.S. citizen, U.S. national, or otherwise lawfully present in the United States. And you need to be someone that doesn't have health insurance. So if you are already enrolled in Medicare, the state's Medicaid program, which in Massachusetts is Mass Health, or you have other public health insurance coverage, you should not be applying for coverage through the Health Connector. Also, if you're offered affordable, comprehensive health insurance from an employer. So when I say that, it doesn't necessarily mean your employer. It could be employer-sponsored insurance, let's say from a spouse or partner. If you have access to that, you are not going to be found eligible for coverage through the Health Connector. Also want to acknowledge that if someone is in jail, they would not be eligible to get Health Connector coverage. So when can you enroll? So open enrollment, I'm hoping open enrollment overall is a term that many of you are familiar with. For those of you who aren't, open enrollment as it relates to health insurance is essentially the time of the year when you can apply for new coverage for the coming year, you can renew coverage, or you can shop for a new plan. So typically the Health Connector's open enrollment runs from November 1st through January 23rd. Now, because of the global pandemic, we and our mission to ensure that people have access to health insurance coverage, we have extended our open enrollment period. So right now, open enrollment is running through July 23rd. So what that means is it does not matter to us, for whatever reason you do not have health insurance coverage, you can in fact apply for coverage, and if you qualify, you can enroll in your plan. Now, for all Health Connector plans, I just want to state that all health, all dental plans, they can start as early as the first day of the month after you enroll. So what that means essentially is today is May 11th. You would want to, apply, get all of your information into our system. The application actually can give you a real-time determination. So once you've entered everything, it can tell you right away what it is that you qualify for. You don't have to wait and come back in a couple of days or anything like that. But there are some deadlines that you do need to keep in mind. So today is May 11th. If you're looking for coverage for June 1, if you're required to make a payment, you need to make that payment by May 23rd in order for your coverage to be effective June 1. So I go through this later on in the slides, but again, just want to while I have your attention here and you're thinking about this, want you to know that all of the coverage begins on the first day of the month after you enroll. Now, if somebody is in a situation where they need coverage sooner, we can't stress enough that you should just apply right away. You may find out that you're eligible for Mass Health. And Mass Health coverage, some of their coverage types can start as early as the next day. So Mass Health is a separate set of programs, a separate agency than the Health Connector. So I don't want to go too deep into Mass Health, but just know that we are closely related. We share an online application. So if by applying to that one online application, you can find out which type of coverage you're in fact eligible for. So there are 3 ways to apply. You can apply online at mahealthconnector.org. We also have a fully functioning Spanish website. Both our web information as well as our online application is available from mahealthconnector.org/es. You can also apply over the phone. So if you aren't someone that has access to technology or you don't feel comfortable completing an application on your own, you can call Health Connector's customer service and a representative can work with you over the telephone, take all of your information and help you complete your application. And then lastly, I want to acknowledge that you can apply for health insurance coverage through the Health Connector with help from a community organization, a partner community organization, or even a health center. I mentioned on a slide back or two that there's only one application to find out if you qualify for coverage through the Health Connector, if you qualify for helping for coverage or for coverage through the state's Medicaid program known as Mass Health. I want to be really upfront here that if it turns out that you qualify for Health Connector coverage, we are legally required to send you a letter or Mass Health is legally required to send you a letter that tells you that you don't qualify for Mass Health. And conversely, if you qualify for Mass Health, the Health Connector is legally legally obligated to send you a letter telling you that you don't qualify for our coverage. So I don't want to, I guess I'm trying to head off any confusion because sometimes people will call us or reach out and say, hey, I thought I was eligible for Health Connector coverage, but I just got a letter from Mass Health saying I don't qualify. I'm confused. So know that you will, because we share an application, you will get letters from both agencies. All right, so what things do you need to have with you when you are ready to apply? So you're going to need social security numbers for everyone who's applying, if they have one, immigration documents for anyone who's a non-US citizen who's applying. And if you have some immigration documents or you're not quite sure, you've got them, but you're not sure what this thing is actually called, you can, when you get this presentation, click on this link. We have a great guide on our website that actually shows you an image of a sample document and tells you exactly what type of document that is. Now, in our application, we also need to collect information about your pay. So if you have it, we'll need information from your last 2 pay stubs. If you are currently collecting unemployment, we need information that comes from this is technically called your monetary determination. You would have gotten that in a letter from the state's Division of Unemployment Assistance, or if you are collecting unemployment and you're using their online system, you can go into your online account and you can get this information there. And then overall, we need information about current income. We're going to need information about your yearly income. So I will get to that in a moment. But the last bullet here simply is just an acknowledgement that if you don't have all the information that I'm describing above, we will send you a letter asking for more information. But we really want to encourage people to gather as much as they have and then begin the application process. We don't want you to delay in getting this process started. I think there are a couple important things to note about this, which is if you start the application on your own online, you can always call Health Connector customer service and they can pull up that application and they can continue on wherever you left off. And the same is also true for any of our community partners. If you've started, they can help you get across the finish line. So certainly we don't want you to delay in getting this process started, and we certainly will be reaching out if we need more information to get to a point where we can make an eligibility determination for you so you know what you qualify for. Now, there is, when you go to mahealthconnector.org, what I'm showing you right here actually isn't the landing page that you're going to see right off. You're going to start off at mahealthconnector.org, and then you're going to, if you choose apply now or sign in, you end up going to this location. So you'll see the link to the website in English, also the link to the website in Spanish. And as a reminder, one application for the Health Connector, finding out if you qualify for help, and Mass Health. So this is really just one application. A couple of things to point out here. If you have ever completed an application before, you do not need to create a new account. You do not need to create a brand new application. You could simply sign back in, update your information, and go from there. That system, some people have had difficulties because they try to go in and the system kind of stops them. Essentially, we try to stop people from creating duplicate accounts because it just kind of messes things up for you later. So if you have any difficulty getting back into the application that you'd created before, simply reach out to customer service, Health Connector customer service, and they can help you get back into that application. So on this slide 16, I just want to talk a little bit about how you enter income if you're unemployed. So when you complete an application, you're going to be asked about current income as well as what you estimate your income is going to be for the entire year. So for current income, it's your income as it is right now. If you're collecting unemployment, you need to include that. Now, you want to then be able to enter what you expect to earn for the entire year. Now, I know obviously none of us have a crystal ball, and this past couple of years have been a little, it's just been very challenging for a lot of people and a little uncertain. So with that being said, here are some general guidelines that we hope can help you. So given that we're at the beginning of May, you want to consider how much you've earned so far this year. If you're collecting unemployment, you want to include any extra dollars you're getting, any extra, I believe there's an extra benefit that runs through September with unemployment. I believe it's an extra $300. So if you are collecting that, you do need to include those extra dollars. And if you think you're going to be returning to work later on this year, or you're returning at, you're working a little, a few hours here or there, you want to include that into what you think might be earned. Now, if your income changes later, we really encourage you to update your income information so it's as correct as possible. And there are a couple of different reasons for doing that. First of all, if you keep your income information as accurate as possible, it helps make sure that you get the right amount of help paying for health and dental insurance. And it also helps you lower your risk of owing money to the IRS when you file your taxes next year. So you might be wondering what this connection is. So at the very beginning of this presentation, I mentioned advanced premium tax credits. So advanced premium tax credits are dollars that you're getting from the federal government in advance. And these help you lower the cost of your monthly premium. Now, people, when you apply for health insurance coverage and help paying for that health insurance coverage, based on your situation, you may qualify for a certain dollar amount. Let's just say that you qualify, I'll just try to use a number. Let's say you qualify for $200 a month of advanced premium tax credits. You can actually decide not to take the full amount of those tax credits that you're eligible for, but rather less. So if you go down to the last bullet here, there is a slider tool when you're in the application that lets you choose less than the total amount that you are eligible for. And that will help you reduce the risk of owing the IRS any extra dollars when you file your taxes. So again, keep in mind, you may qualify for a certain amount. You're not required to take that full amount. You can, in fact, decrease that. So on slide 19, I'm just going to dive a little bit deeper into the two kinds of help you can expect through the Health Connector. So I keep talking about these advanced premium tax credits. So again, they lower the premium amount you pay each month. The IRS is going to send that tax credit directly to the insurance company. So you'll pay less. So it doesn't come to you. It's going to go directly to them. And then you, as the consumer, you get to decide if you want to apply all of that or some of that to your monthly premium payment. Now, unique to Massachusetts, we have what we call the Connector Care program. So the Connector Care program, comprehensive coverage, low to no cost plans. And the way in which we do that is we use federal advanced premium tax credits plus state dollars, and those together help reduce the premium amount that you need to pay each month. So I mentioned, low or no cost plans, depending on what you're eligible for. I want to also acknowledge that there are low out-of-pocket costs, so low co-pays when you get services or you pick up prescriptions, and there are no deductibles associated with the Connector Care plans. And now, depending on the type that you qualify for, the plan type, you could choose a plan for as low as $0 or $133. So I have some slides at the end of this presentation that I'll step through that I think can help guide this a little bit better for you. So you might be wondering if you in fact qualify for these savings. So you may be wondering, okay, what are the income guidelines to get help paying for coverage through the Health Connector? So for the Connector Care program, the income limit is 300% of the federal poverty level. So if someone's income is at or below 300% of the federal poverty level, and they meet all of the other eligibility criteria, you otherwise qualify, you could enroll in Connector Care plans, Connector Care coverage. So as an example, if your household size of 2, if you have a household size of 2 and you're making $51,720 or below, you may qualify for Connector Care plans. Now, I want to talk about advanced premium tax credits and this 400% FPL limit. So we have this listed here, but I want to explain that the American Rescue Plan now removes this income limit for advanced premium tax credits. So it could help people with incomes above 400% of FPL get help paying their monthly premiums. So although the American Rescue Plan was signed into law in March, staff have been working very hard to implement all of these changes. So this month, we were able to make system changes so that if anybody had an income greater than 400% 400% of the FPL, you could find out if you qualify for advanced premium tax credit. And the reason this happened is because instead of an income limit, the American Rescue Plan basically allows people to qualify for advanced premium tax credits based on affordability. So it makes advanced premium tax credits available to help lower someone's monthly cost of health insurance so that they're paying no more than 8.5% of their annual income for health insurance coverage. That is essentially what is going on behind the scenes. These are not things that you need to kind of figure out before you start to apply, but we will have a tool that will help you figure that out to determine whether or not you do want to apply. But I will say the system, there's logic built into the system that's going to help figure this out for you. So once you have applied, you found out what you're eligible for, you're going to need to choose a plan and enroll in that coverage. So in terms of choosing the right plan, we have different tools at the Health Connector that you can use, different online tools that you can use to enter provider and medication preferences, and that helps you find plans and also find pricing. So if you are just trying to compare, medication and provider preferences, you can use our plan comparison tool. If you are looking, if you looked at that chart, let's say that I showed you and you're like, no, I'm in a different situation. I don't think I'm going to qualify for assistance. I just want to shop and I want to see what these plans are going to cost me. We have a preview plans tool that's available from our applications homepage where you can just enter some very basic information about your age and where you live. And that tool shows you what the plans cost in your area, what your options are in that area. Now, I want to caution you, if somebody qualifies for Connector Care, they're not going to see the cost savings displayed from this tool. And also, I want to acknowledge that all of these savings that I've been talking about that are available through the American Rescue Plan, those savings aren't showing right now either. We're hoping towards the end of this month that we're going to have a tool finalized and available from our website where you can simply enter some basic information about yourself and find out at that point, or basically at that point, like, see an estimate of the cost of the plans that are available to you. So we look forward to having that be ready. I would encourage anyone who's interested in coverage now to certainly apply now. There's no reason to wait. I think it's important to say that just by applying, you are not obligated to enroll in coverage. So please keep that in the back of your minds. When you are in the application, you have the ability to also enter your providers and facilities that you are interested in finding out if they're, in a particular plan, or if you're taking particular medication, you can confirm whether or not that medication is covered in a plan. And this is essentially what it looks like when you're completing the application. On slide 24, here you're seeing that I've entered a couple of preferences. So I've entered a couple of doctors, a couple of providers, as well as a health center that I'm interested in finding out, whether or not these plans are affiliated with these providers or this facility. And you can see, basically, you'll see the screenshot here is just simply showing you one plan option, but there are many plan options, and you can sort and you can filter the results as you're going through. Now here, I just want to acknowledge that if you're required to make a payment, it must be received by the 23rd of the month before your enrollment is considered complete. So when you're in the application, you could submit a payment by clicking the Make a Payment button on the My Enrollment page. So you can do this all as you're going through. Everything can be done online. Now, in this section, section 3, I want to talk a little bit more about getting help. I think I've already mentioned that we have a Health Connector Customer Service Center that's available to assist. We also have community partners. And here, I just want to acknowledge that all of this help is available to you for free. So free enrollment assistance is available through our customer service or through community partner organizations. So customer service, our number is 877-623-6765. If anyone is deaf or hard of hearing, etc., you can see the TTY number listed there. If you want information about our hours, days of operation, you can click on the link and you're going directly to our website. Typically during open enrollment, we have some extended hours, but you'll be able to see right now, I believe our hours are from 8 a.m. to 6 p.m. Monday through Friday. Also want to acknowledge or tell you a little bit about community partners. So who are these people that are, trained and available to help you? These are known as navigators or certified application counselors, and these folks speak many languages. They can help you from application through enrollment. They can answer questions about eligibility. You can certainly work with them for any part of the process that you're in. Particularly right now, we recommend that you call ahead and schedule an appointment for help. So if you're looking for some personal assistance, you can click on this link, enter your zip code, and you can see which organizations are available. Again, I can't stress enough now that it's important to call ahead to make an appointment. We know some of these organizations are accepting in-person appointments, but many are still doing telephone or online virtual appointments. So you can decide where your comfort level is and get assistance from these folks. Very, very valuable help. So let's spend a little bit of time going through some reminders and things I'd like you to step away from this presentation with. So I don't know exactly where all of you are coming from. There are many participants, so there may be different reasons why you want to learn about health insurance coverage through the Health Connector. So for those people who have lost employer-sponsored insurance, if you've lost employer coverage, know that that's considered a qualifying life event, and that gives you a special enrollment period to enroll in coverage for the Health Connector. You just want to be sure that you apply and compare your options with us within 60 days of losing your employer coverage. You can apply for coverage online, over the phone, or with the help of an assister or community partner. And some people are going to get an automatic special enrollment period to shop and enroll right away. Now, as I mentioned, we are in an open enrollment period right now, so you don't have to worry or think about like any qualifying events. You don't have to think about any, will you be stopped from applying and shopping. If you run into any troubles, if you apply online and for some reason you cannot shop for a plan, please contact Health Connector Customer Service for assistance, and they can help get you across. And keep in mind, if you're looking for coverage to begin on June 1, remember you need to apply, you need to apply, pick your plan, enroll, and pay your first premium by the 23rd of the month before your coverage can start. So again, here you're seeing this example, May 23rd is your deadline for coverage that starts on June 1. Technically speaking, I just want to acknowledge that if you'd like your coverage to begin on July 1, you do have that choice. You can select to have your coverage start on the second month after you enroll. And I do sound like a broken record here where I keep saying, you can get free help with this process overall. I know I've covered a lot of details, a lot of information, but know that customer service is available to assist. Our certified application counselors, our navigators, these are our partners in the community, and they are here to help as well. So please don't hesitate. You can call today and you can make an appointment to see someone. So with that, I just wanted to check in, Shaitra and other team members. I think we're ready for some questions.
Yes, Nikki, thank you. That was extremely informative. And I know I took a lot back coming from the other side, the business side. Just really quickly, Nikki, do you mind putting up the slide with our assisters and navigators and our customer service line to assist anyone? I know many people have personal issues that they would like to discuss in more detail than we can provide through this presentation. So I just want to make sure that's up there and available for them so that they could jot down our customer service line there. Perfect. So
Sorry,
Nikki,
I was clicking in the,
yeah.
I'll leave this here. I was clicking in the wrong direction. I apologize, everyone.
No problem. And Nikki, you did say this was free assistance from our community partners. Am I correct?
You got it. Free help. We have, so maybe I'll just describe this a little bit. So Health Connector Customer Service is a separate customer service center from Mass Health. Just in case anyone has any experience with both of our agencies, Health Connector is its own entity. 877-623-6765. Community partners. So we're grouping a couple of different types of people. We've got grant recipients. These are our navigators. These are Health Connect navigators. They've been trained specifically on Health Connector plans, but regardless, they can help you if you qualify for Mass Health. They can help you with that as well. Remember, it's one application for the Health Connector as well as Mass Health. So navigators as well as certified application counselors basically can help you from start to finish with this process.
Thank you, Nikki. Yeah, so if anyone definitely had a very personalized question during the presentation, I'm definitely going to try to ask Nikki this in the most generalized way. But if you do need more information, please feel free to reach out to one of our community partners or the customer service line. Nikki, we did have, of course, some questions about American Rescue Plan. People were intrigued to find out, is the American Rescue Plan based on the current COVID-19 national emergency, or is this something that's going to be permanent?
So, what I wanted to do here, I realized after, I do have a couple of slides on American Rescue Plan that I just want to use as reference. And again, you're going to get the slide deck. So they're not included here, but I'll just answer your question. And my colleagues, feel free to jump in here as well. I want to acknowledge that the American Rescue Plan is not, so there are aspects of the American Rescue Plan, aspects of savings that are specific to this year, so plan year 2021. And then there are savings that are going to be in place for a couple of years. And there has been talk of some things being in place permanently, but again, things are in flux. We don't have all of those answers just yet. So maybe what I'll do is I'll step through some of these things and just kind of note when things, where things have changed. So with the American Rescue Plan, I think I mentioned some people whose income may have been too high before now may be eligible for coverage. So those American Rescue Plan benefits for those people over 400% of FPL, I believe are in place for 2 years. Again, anyone who wants to have access to the savings, and you have to enroll through the state's Health Connector in order to get that. Let's see, skipping down to the last bullet here, there's a provision there for people who received unemployment income at any point in 2021. And that's going to give people access to low or no cost connector care health plans. That is only for 2021. So if somebody somebody got unemployment income at any point in 2021, we are working to be able to give this to folks. So in case you're wondering, like, what do I do to get access to this? I would say apply now. And you will, see what it is that you qualify for, indicate that you are currently collecting unemployment insurance. And then you can see some of those savings. And then as we go forward, you'll likely be seeing even more. If you collected unemployment insurance and you got Health Connector coverage, but you didn't get all of your savings, any of those savings that you were eligible for, you're going to also see those when you file your taxes next year. I want to also acknowledge this, and I know I'm sharing a lot of detail, so I'm going to pass the baton over to my colleague, but I want to be sure you guys see these slides. This is something that is part of new Help Paying for COBRA is part of American Rescue Plan. This is only for this year. Basically, there are people who are eligible for COBRA. Certain people who are eligible for COBRA can get access to COBRA for $0 a month. That's only available from April through September. And maybe I think I should stop talking because I've said a lot. Kayla and Kayla and Chaitra, is there anything you want to either, I just want to make sure I didn't misspeak on any of the terms that these benefits are available for, or anything else you want to add here?
Nope, that's right. And on the COBRA piece, I would just say reach out to your employer if you have questions. That's the best place to go.
Okay, great. Thank you.
And
did that answer that question for that person, Chaitra?
Oh, it answers several questions, so thank you. But I just want to confirm, I think I heard you answer in there. The only place that people can get the American Rescue Plan savings is by applying through the Health Connector. Am I correct?
Yes. I think I just want to be really clear about that. If you are a Massachusetts resident and you're looking for coverage and you'd like to gain access to these savings, you do need to shop through the state's Health Connector. We're the state's marketplace, and our plans are going to give you access to these savings.
Perfect. Now, if someone knows they are going to lose insurance, whether it be employer-sponsored coverage, COBRA, health insurance, wherever else, when should they apply on the Health Connector?
If you are in a situation and you know that this change is happening, you can do that within 60 days. So 60 days before or 60 days after that date. So that date that you're losing access to coverage is really is the important detail when you're completing our application.
Okay, perfect. Also, when updating information, people are going through changes in their income mid-year. When you're updating the information on your application or your existing thing, when does the premium change take effect?
Okay, so let me be really clear with Health Connector plans. You would need, well, let me say this. So as soon as you know that something has changed, you should alert us. So try to keep your application as up to date as possible, just so you don't, let's say, get any extra advanced premium tax credits that, essentially everything comes out in the wash at tax time. So we just try to, we want you to know all of this upfront so that you're not surprised on the other end. But I think the question is, when I do update my information, when do I need to do it by so it'll affect my premium? So you would need to make changes and update your application before the 23rd of the month. Remember, everything you get billed at the beginning of the month for the next month of coverage. So you need to make application updates prior to the 23rd.
All right. Quick question. So say, there's these great options now through the American Rescue Plan, and maybe in the past, those, obviously we know those savings weren't available. So if a person does not have access to employer-sponsored coverage and has gone directly and bought insurance elsewhere on their own, is this now an opportunity for them to go ahead and cancel that private insurance, wherever it is coming from, direct to carrier or someplace else, and now enroll through the connector to get those savings?
So actually, this is a really good, yes, the answer is yes. This is a really good opportunity for consumers. So I don't want to say, give a specific carrier name, but I'll just say, let's say you're enrolled with carrier X direct, and you're getting your coverage directly from that carrier. We have gotten confirmation from all of the carriers on the Health Connector's website that if you have that coverage with that carrier, and we know that you've probably been accruing towards deductibles, right? So we've gotten confirmation from all the carriers that if you come to the Health Connector and you enroll with that same carrier, they will honor all of the accruals that you have that you've accumulated towards your deductible. So I would suggest, if you're, happy with the plan that you have and the carrier that you have, and you're just trying to get the additional savings, you can shop on our site for a similar plan. You can double check with the carrier, but our customer service can help you enroll into coverage with that same carrier.
Great. And just to go back to the American Rescue Plan, I just wanted to confirm with you, just in case a few people had questions about the timelines. The premium tax credits for over 400% federal poverty level, those are good for 2 years, right? The September part you were talking about was for COBRA subsidies. Am I correct?
You got it. And I apologize. I know we're throwing a lot of dates at you, months at you, but essentially this law just rolled out in March. So we're really excited that we've been able to put a lot of the provisions in place so far. So right now, if you are a person with income over 400% of FPL, you essentially could apply. And if you are eligible for a plan with subsidies, you're going to see that now. You could see that, and you could get into a plan with additional subsidies as early as June 1. So the system is set up to do that right now. If you are someone who applies and your income falls under that 300% threshold, you will see right now, new and more savings coming towards you through more advanced premium tax credits. So those two things are in place, and they will be in place for 2 years, 2021 and 2022.
Okay. Another question about American Rescue Plan. This is good. So
Okay, good.
you mentioned that no plan will cost more than 8.5% of the income for an individual as part of the ARP. Is that based on annual household income?
So let me clarify what I said. I want to be really, because this can get really tricky. Essentially, what is happening is, where on the back end, the system is taking all the information that you enter about you and your tax filing household, and it's trying to help you get to a plan that is no more than 8.5% of your total annual income. And if it's found that there is a gap between where you are in the plan, an affordable health insurance plan, it will fill that gap in with advanced premium tax credits. So I know this is not a simple concept to grasp. So this is always where I like to ask if one of my colleagues wants to maybe say it, but using different words, because even for me, like I know I've been living in this, I've been working with this, and I'm like, how do I explain it? This isn't, it's not that simple, but yet if you think about the fact that anyone who's applying has different circumstances, and based on their age, where they live, their income, all of that information is taken into consideration. And these advanced premium tax credits try to fill in a gap so that we can get someone to have access to a set of plans that are no more than 8.5% of their income. So I'm sorry to call on you, Kayla, but I'm going to ask you if you want to say this in a different way too.
Yeah, no, I think that's right. I agree. It's a tricky thing to explain, but I think the main point is that there are a couple different things that go into play in the calculation. That's all done on the back end. So you just apply and the calculation is done. You don't have to really worry about the calculation. But basically 8.5 is like the cap at the higher income level. So depending on your income and where you live and your age, you could be paying 2% of your income on a plan. Just, and again, like Nikki said, the subsidies sort of fill that gap. So it really is sort of like a phased out process of subsidies, and those percentages of income you might pay go all the way up to 8.5%, but cap off there, but they could be lower. Yeah, sorry. I know it's a little tough to draw that out.
No, but I'm glad you mentioned that it could be lower. I'm glad you mentioned that. So it's definitely worth, as I said, you can apply, and you're under no obligation to enroll. You can just apply and see what it is that you're getting access to.
So Nikki, we're running a little short on time. I just wanted to get across at least another 2 questions. What should individual or family include in their income when reporting through the application?
Okay, so I think it's so any income that is earned. So any and then there's also a lot of income that you can also exclude. So in the presentation, well, hold on one second. There is a link on our website, and let's see. We have detailed information on our website to help you determine what income needs to be included or not included. So essentially, there are things that you don't have to include. So for example, you don't have to include child support. You do have to include unemployment income. You do need to include any income from a job. So I would suggest, if you are thinking about your own personal situation, to check this list to find out what category any income that you're earning is in, if it's something that needs to be reported or something that doesn't.
Great. And before, just to follow up on something that you noted before, you said that the carriers are honoring deductibles.
Correct.
Does that count also if the person changes the plan they are enrolled in?
I believe that's true. Following this presentation, I'm not sure if any of my colleagues knows for certain as well. I believe it's you need to stick with the carrier. I don't know that you have to stick with the plan, but it might get a little bit more complicated if you don't choose the same level of coverage, because your deductible is different, right? So what I will do is we can follow up with colleagues, and when I send the email out, I'll send it within the next 24 hours. I'll get that question answered for everyone.
Yes. And really quickly, while I still have you, if an individual has access to employer-sponsored coverage,
yes,
what is the only option that they have? If it seems costly, what is the option for them to come to the connector in lieu of the employer-sponsored coverage?
So I would suggest, if you are looking at the coverage that your employer is offering you and you're thinking, you know what, this is really expensive. It just doesn't seem affordable to me. I would say come to our website, and there is a sample like affordability calculator that you could use, or if you want to, you can go into the application, enter all the information in the application. We're going to need to know how much the employee only plan costs, how much the employer contributes, what your contribution needs to be. And again, the system will do a calculation to determine if the plan is affordable based on the state's affordability schedule.
So we've gone a little bit over time, Nikki, but we do have one more question. And that question is, if someone will turn 65 shortly, and becomes eligible for Medicare, do all of the benefits of the American Rescue Plan disappear? Is there any answer you have to that, or someone we could guide them to?
So I would recommend, so I can answer part of it, and then I would recommend that anyone who is getting closer to 65 connect with an organization called SHINE. And this organization is statewide, and it's SHINE stands for Serving the Health Insurance Needs of Everyone. And they're a really great organization to help people transition either from employer-sponsored coverage to Medicare, or Health Connector coverage to Medicare. They're just a wealth of resources. So with that being said, if somebody is getting close to becoming eligible for Medicare, when they are eligible to enroll in Medicare, they're no longer eligible anymore to have advanced premium tax credits, because they're now eligible for another type of government sponsored insurance. So it's, obviously you want to be paying close attention to any communications that you're getting from Medicare. And I think with Medicare, if I'm not mistaken, you can enroll 3 months before 65 or 3 months after, but I am beyond that, I'm outside of my area of expertise. I would say contact someone from the SHINE organization, and we can share, I'll include that information as well in my follow-up email.
Great. Well, Nikki, we have gone over the time right now, and I'm sure others have maybe have questions. Again, you said they could contact our customer service line or any of our navigators. And again, thank you so much. Is there any takeaways you'd like to end this off with, Nikki?
No, just yes, I shouldn't say no. Yes. So first, thank you everyone for staying with us. We know it's a lot of information. Remember, open enrollment ends July 23rd, so you still have time. Act now, though. Get this process started. And we really, with the American Rescue Plan and all these new savings that are available to you, please don't hesitate. Let's get you those extra dollars right now as soon as possible. So thank you, everyone. And thanks to all of my colleagues who were behind the scenes and who I can see right now who've been providing support. We really, we're here to help. So thanks, everyone.